Now we will discuss about pasteurellosis or fowl cholera. So for the introduction, this disease is a highly contagious bacterial infection in poultry animals. It affects domestic fowls such as the chickens and ducks, game birds such as pheasants, quails, and turkeys, and small feral birds. Turkeys are more susceptible probably because they have a lower or weaker immune response towards the bacterial infection. Also, mas susceptible din daw yung mga older na birds kaysa sa mga mas bata. Next, we go to the etiology of the disease. The disease, Pasteurellosis, is caused by Pasteurella multocida, which is a small gram-negative non-motile rod that exhibit pleomorphism after repeated subculture, which means na after niyang makulture in the laboratory ng siguro madaming beses or magkakasunod na beses, mag-start na siyang i-alter yung morphology niya and other metabolic behavior para bumagay sa environment or agar kung nasaan siya. Next, we go sa transmission. Transmission can happen through ingestion of Pasteurella multocida, which are probably mixed in feeds or in water. Pwede rin na mechanical transmission via vectors such as rodents, pigs, dogs, and cats. And pwede rin na through inhalation. So dahil nga maliliit naman ang mga bacteria, they can get suspended in the air for quite some time. Tapos, kapag na-inhale sila ng susceptible animal, magsisimula na silang mag-incubate until they can cause clinical signs and lesions doon sa animal. So the bacteria can also be transmitted via feces. Pwede siyang maisama sa tae ng animal and then after that, kakalat na siya sa farm kapag natapak-tapakan nila yon. So, mag-spread siya dun sa may farm. Then we have contaminated soil. Same din kapag natapak-tapakan ng chickens yung soil na may Pasteurella multocida, tapos pwede rin na galing sa equipment and people. Pwedeng nakadikit sa kanila yung bacteria, tapos kapag naipasok yung equipment, tapos pumasok yung tao doon sa loob ng farm, pwedeng mahawa yung mga hayop na nandoon. And hindi rin kasi natin alam if yung equipment ba na yon at yung tao na yon ay carrier na ng Pasteurella multocida kasi nga 'di ba vectors lang sila, hindi naman sila nagso-show ng clinical signs or whatever na lesion. Tapos so dito na papasok yung good na biosecurity. So dapat lahat ng papasok na equipment, lalo na yung mga tao, dapat kuwan sila like na-disinfect at malinis dapat. Then yung sa incubation period ng disease, it usually takes about 5 to 8 days. Next, we go sa clinical signs. So mayroong dalawang forms ng fowl cholera. Yung first is yung acute form and yung pangalawa is yung chronic. So first, dun muna tayo sa acute. Acute form, it shows high morbidity and mortality rates. Yung signs na makikita dun sa animal is yung ruffled feathers, fever, anorexia, hindi na siya kumakain, takip niya, rapid breathing, cyanosis of wattles and comb. Makikita natin dito sa first na picture, nagkukulay blue or violet na yung itsura ng manok. And then, mucus discharge from the mouth and nose. Now, dun naman tayo sa clinical signs plus lesions ng chronic form ng fowl cholera. So, birds that have survived acute infection or exposed to a low virulence strain generally exhibit localized infections. So, ito yung mga birds na na-infect ng acute na form ng disease pero nabuhay pa rin sila. Although buhay sila, hindi na mawawala sa katawan nila yung Pasteurellosis. So, they will exhibit these lesions and signs. So, yung um, first na meron sa kanila is yung exudative inflammation ng wattles. So, makikita natin yun dito sa first na picture. Nakikita natin na lumaki yung wattles ng manok. Tapos, ang laman nun is exudates. And then, we have torticollis. Ito naman is due to meningeal infection or middle ear infection. Kaya nagtutwist yung ulo ng manok. And then, this may last up to 3 to 4 weeks, and sometimes it can persist for years. So, punta naman tayo ngayon sa postmortem lesions ng acute form ng fowl cholera. We have here petechial and ecchymose hemorrhages na makikita natin doon sa may ventriculus at proventriculus. So makikita natin yung mga yon dito sa may stomach ng animal. Ito siya, nakakalat siya dito. Itong mga to, yung mga petechiae. Tapos yung mga ecchymose na hemorrhages. Ay, yung mga yon, yung mga mas malalaki ng konti kaysa sa mga petechiae. And then, egg yolk peritonitis. The lesions in the ovary may include hyperemia, just like in the ovary of this hen, and acute fowl cholera shows severe hyperemia. Hyperemia occurs when excess blood builds up inside the vascular system due to inflammation. And then we have the postmortem lesions of the chronic form, which are localized infection throughout the body. We have here, makikita natin siya dun sa may hock joints, foot pads sa wattles, and sa ears. Next, we go sa diagnosis. First we have the bacterial culture. Tapos kapag magkukulture ng Pasteurellosis daw, ang gagamitin na agar ay yung blood agar. Though pwede siyang gumamit ng ibang type ng agar, mas maganda ang growth ng Pasteurellosis doon sa blood agar. And then we have PCR, which has been used for the detection of Pasteurellosis in pure and mixed cultures and clinical samples. This method may help identify carrier animals within the flock. Next, we go sa differential diagnosis. Erysipelas, which is primarily an acute infection that results in sudden death. In unaffected flock, a few birds may be depressed but easily aroused. Within 24 hours, a few birds will be dead. But just before death, some birds may be very droopy with an unsteady gait. Chronic clinical disease in a flock is not usual but does occur, and birds may have cutaneous lesions and swollen hocks, just like sa chronic form din ng fowl cholera. And then we have infectious coryza, which is a widely occurring respiratory disease of chickens that results in acute inflammation in the upper respiratory tract, nasal discharge, facial edema, and conjunctivitis. Then we go sa treatment. So using antibiotics may help reduce the mortality rate, but it cannot eliminate Pasteurella multocida in the flock. Mortality rate can be lowered during the course of treatment. Pero kapag tumigil na yung treatment or kapag tinigil yung treatment, magre-resume ulit yung deaths. So when using antibiotics, early treatment are required and adequate dosage are important. Pero bago mag-start ang treatment, meron muna tayong tinatawag na sensitivity test. Ginagawa ito para makapili tayo ng tamang gamot or antimicrobial against Pasteurella multocida kasi meron ng strains na resistant sa ibang gamot. So, meron yung sulfametazine or sulfametozine, which are sulfonamides. Tapos, hinahalo siya sa feed and water para makontrol yung mortality rate. Although, kapag gagamit ng ganitong gamot, dapat careful tayo sa breeders kasi pwede siyang maging toxic. Hindi rin siya pwedeng gamitin sa layers kasi nga 'di ba yung eggs kakainin ng mga tao and matagal ang withdrawal period ng antimicrobials. Then we have tetracyclines. High levels of tetracyclines in feed or drinking water or administered parenterally may be useful. And then we have penicillin, which is used in turkeys kapag yung strain na naka-infect sa kanila ay resistant sa sulfonamides. Tapos sa ducks naman, injection ng streptomycin at dihydrostreptomycin ang ginagamit na gamot. Next, we go sa control and prevention. So, sa dito naman, dapat ma-eliminate yung mga carriers such as yung rodents, wild birds, tas yung pets like cats and dogs, and pigs. So the first one is also a part of good management practices and high level of biosecurity. And then we have the vaccines. So one of them is yung Polvac, which is injected subcutaneously, usually sa may leeg ng manok or sa poultry. So kapag chicken, binavaccinate siya at 12 weeks old, tapos i-revaccinate ulit after 4 to 5 weeks. So, ang usually na ine-injectan ng vaccine na mga manok is yung nasa 12 weeks na kasi nabanggit natin kanina sa first part na mas madaling maapektuhan ng fowl cholera yung mga mas matatandang manok. So, mas susceptible sila, mas kailangan nila ng vaccine kaysa sa mga mas bata. And then sa turkey naman, bina-vaccinate sila at 8 to 10 weeks, tapos i-re-vaccinate again after 4 to 5 weeks.